Yes.
Yeah.
It is not operating big organs like kidney or prostate or so on.
Yeah, we use the microscopes.
Yes.
Yeah, operating
Yes.
microscopes. Yeah. I remember during our rotation, I think it was just 1 month, so
I
we didn't
see.
really get so much. Yeah.
Mm,
All right.
have you any maybe willingness to visit Russia one more time or
Hello.
no?
Yes, so good afternoon to all those who have joined.
Okay. Goodbye.
Yes, so we will be starting in the next 2 minutes. We are waiting for those who are a bit late to join so that we can start. Yes. So Dr. Damir, what we'll do is that we'll try and record the session so that we can share with those who could not join with us. I hope you're okay with that.
Yes. Thank you. It is a pleasure to talk about prostate health and to maybe give some information about importance of this organ.
Okay. Hello? Can you hear me? Jeff, can you please speak? We want to be sure that we can hear you.
Yes, I can hear you, Joseph.
We can hear you.
I can hear you.
Okay, yeah, we can hear you now.
All right.
Dr. Damir, can you please speak? Let's see if we can hear you.
I can hear you. Can you hear me?
Yes, we can hear you.
Okay. So.
All right, good. Paul, we are welcome. Can you hear us?
Yes, I can.
All right. You are welcome.
Thank you.
Hello, Joseph. I think Dr. Anchitu is online. I think he can test his mic as well.
Okay. All right. Dr. Andrew, good afternoon.
Hello, I can hear you loud and clear.
All right, Doc, you are welcome.
Thank you, sir.
So we are starting in the next minute.
Good. I wanted to be sure as to how I'm going to roll my slides.
Okay, so when you are ready, I will. So Dr. Andrew, when you are ready, I will allow you to share your screen.
How do I do? I wanted to be very sure. Anyway.
Or you can send your slides to Jeff so that we can project from our end here.
Okay, I'll try and see. Okay, share. Okay, I think I should be able to share it here.
Okay, all right, that's fine. So, Jeff, we are ready to start. So we will ask Elder Botwe to say a word of prayer. Then you take over.
All
Shall
right.
we pray?
Not.
Shall we pray? Our Lord and our Master, we bless you for a day like this, when as men, you could gather us to talk about health, about longevity, and about how we can keep fit in order to glorify your name. We ask, oh Lord, that you grant us understanding. We ask for your blessings on our resource persons. And at the end of the day, may we have cause to give you all the praise and adoration. We thank you for hearing us. In Jesus' name, amen.
Amen. So, Jeff, maybe before you take over, let me welcome our friends who have joined us on Zoom. You are welcome to Bethel Seventh-day Adventist Church. And this is a program organized by the Adventist Men's Ministries. And this afternoon, we are going to discuss about prostate. And I believe that all of us have heard of it and some of the issues that pertains to this very important organ. So I'll hand over to Dr. Wiafe Jr. to take it up. Doc.
Hello. Good afternoon and good evening to everyone. Thank you so much, Joseph, for the opportunity, and most especially Bethel S.D.A Church and the Seventh-day Adventist Men's Ministry for the opportunity. So basically today, we are going to be talking about the prostate. But before I do a brief introduction, I would like to welcome our facilitators in a special way. We have Dr. Damir Kantimerov, who is a consultant urologist. He is based in Moscow, and actually he happens to be a classmate of mine. We attended the same medical school, and he was one of the very few students who spoke very good English. So when Joseph told me about this program, he was the first person that came to mind. And I'm very grateful that he agreed to share his knowledge on what he knows about the prostate. And then we also have a second presenter, Dr. Isaac Opoku Antwi, who is also a consultant urologist and a surgeon. He's based in Kumasi at Komfanuchi Teaching Hospital and Tafo Government Hospital. He also has a lot of experience in the field, and he's going to share with us what he knows, especially what is happening in Ghana. So without wasting much time, I think we'll dive right into it. And I see we have a number of participants who have joined us on Zoom. We'd like to welcome all of you. Kindly let us know where you're watching from. We'll be glad to know where you're watching us from. And for those joining us on Facebook and YouTube, you're also very, very welcome. So soon after Dr. Kantimerov's presentation, I think we'll have a few minutes for questions before Dr. Antwi also presents. So Dr. Damir is going to talk about a benign condition, basically a condition that is not cancerous, and it's known as benign prostate hyperplasia, which is basically enlargement of the prostate. So he's going to go into more details on that. And then Dr. Antwi is going to focus more on prostate cancer, the causes, the risk factors, and treatments available. So basically, that's what we are going to do. Please, if you have, during the course of the presentation, in case you have any burning question, kindly write it down. Kindly write it down. Thank you. All right, Dr. Damir. You can go
good afternoon. Okay, thank you. Good afternoon. It is a pleasure to give you some information about prostate and it is function in male organism and also its diseases. So second slide, please. Is a parenchymic organ which situated just beneath the urinary bladder. So, and what function of this organ is? So it is produce the most part of the semen, and it is also taking part in erectile function. It is also a part of urethra. It is an important point because most dysfunctions and troubles which can give us a prostate, and particularly the enlargement of the prostate, it is due to it is a part of urethra. So, and mainly people cause it second heart of the man. So next slide, please. So let's talk about situations and conditions when you ought to visit your urologist, and you ought to do it very quickly. So it is an emergency conditions. So first of all, it is dysuria. Dysuria, it is painful, frequent urination. So mainly men doesn't give it maybe a lot of attention, but it can be a signal of maybe rather important dysfunction. Second, it is hematuria. Hematuria can be a sign of some oncological conditions. And firstly, today we talk about prostate. It can be it can be due to the cancer of the prostate. So, and another. Can give me the previous slide, please? Yes. Another condition, it is fever and an inability of urination. So in the first column, we can see an emergency situation. Then you ought to visit your urologist very quickly. In the second column, you can see another conditions. Maybe sometimes it is not so important, but they can lead to some dramatical and critical conditions. So these conditions is nocturia. It is frequent night urination, and so it is very close to this. Some symptom is feeling of remaining urine after urination. Another is erectile dysfunction, and maybe the most not emergency, not so critically situation is frequent urination, which can lower your quality of life. So next slide, please. So rather often, pathological situation which can lead to visiting your urologist is benign prostatic hyperplasia. And what it means, what is hyperplasia, and what is benign? So it is an enlargement of the prostate. Every man in the world can have this disease, and so every man in the world in very different ages can have this condition. So some of the men would face it earlier. Some of them would face it in very old age, but it is a condition which will have every man. So a main reason why this prostate tissue is enlarged is enlarging is the decreasing level of testosterone. It is due to the guidelines of American Urological Association. So, and how we can prevent it? For today's knowledge and for today's medical facts, we haven't got any medicine or maybe other medication which can prevent this condition. But we have medicine which can treat the symptoms and which can help us to regress the symptoms of the benign prostatic hyperplasia. Only the surgical treatment is the only way to cure this condition, but it is not a sentence. Don't be in a worry, because not every man with a hyperplasia needs some surgery. So, and only few of patients have indication for just surgical treatment. Another slide, please. And what are the symptoms of benign prostatic hyperplasia? So it is weak urine stream. It is frequent urination. It is dribbling after urination. It is an urge to urinate. It is leakage of the urine or overflow incontinence. It is a critical situation. And another one which can lower the quality of life is frequent urination during night. So another slide, please. So how can we say, is it benign or is it oncology? And so we have one protein which can help us to make maybe some points and to differentiate these conditions. So it is a PSA, prostatic specific antigen. It is mostly using oncomarker in the world, but it is non-specific. What does it mean? The level of the PSA can increase due to some inflammation in the prostate, due to mechanical impact, and due to oncology. So that is why if you have a high PSA level, don't be in a worry. Sometimes it may be inflammation. Sometimes maybe rectal digital examination can lead to the increasing of this level. It is not very specific, but it help doctors to graduate the patients and to monitor the population on the prostate cancer. So, and I think this whole information maybe is critical for people to know. Okay, do you have any questions?
All right, thank you so much, Dr. Damir, for the excellent presentation. Actually, BPH, also known as benign prostate hyperplasia, is quite common here in Ghana. I'm sure Dr. Anshi would also comment more on that. In fact, when I was working in the district, that's one of the emergencies that we get in the hospitals. Men come with, usually they come in severe pain and unable to urinate. So we have to pass the urethral catheters and even tap directly to the bladder, the suprapubic tap. Yeah, so I'm sure there are a number of questions. Probably one which many people would like to know is, are there any specific foods or any supplements that would prevent this condition or would help or would rather even lead to men getting BPH?
So for today's knowledge, all this maybe medicine and so on doesn't cure the reason why the prostate is enlarged. It's only lowering the symptoms, and it's only decreasing the maybe the symptoms of the BPH. But there is no food or maybe some other drugs which can prevent the BPH. So as I have said before, every man in the world would face this problem. But the age of the facing with this problem will be different.
Okay, so age is a risk factor.
Yes. We can maybe monitor the level of the testosterone, and maybe by preventing the decreasing of the testosterone level, we can not in all cases we can prevent the BPH, but it is not the ultimate medicine. Not in all cases and not in all persons.
All right. I have more questions, but let me open the floor to the public.
Okay, there are two hands.
All right.
So we have Elder Frank. Yes, Elder Frank.
Hello. So I have a quick question.
Okay.
One of the symptoms you mentioned was frequent urination. So if somebody is urinating frequently, is that a problem? That means that they have a problem with their prostate.
Not in all cases. It is due to the problems with prostate. but it is a sign to visit your urologist to clarify the problem. Is it due to prostate or is it due to bladder? But in male population, often it is due to the enlargement of the prostate, or maybe prostatitis if the age of the patient is under 40 years.
So if you are more than 40 years, that is a problem.
If you are under 40 years, so the main reason is prostatitis. It can be chronic or maybe acute.
Okay, so
and maybe to clarify how often men should urinate during the day. Well, physiologically, it is from 8 to 10 times, but it is depends on how more water you are drinking during the day.
yes, because here in Ghana, our weather is quite hot and humid, so
Yes. So
we drink a lot of water.
You ought to take in the location of the country and the climate. So it is important.
Okay, Jeff, we have Aurelius. His hand.
All right. Aurelius Lamte, you can go ahead.
Okay.
And ask.
Good afternoon to all of us. I have two quick questions. I wanted to know the role hereditary factors play in one's risk exposure, let me say, to prostate health issues, especially if you have a member of the family, a close member of the family, or who suffers from that condition. And then secondly, this is another advice I got from a medical officer who was suggesting that now after the age of 30 or 35, it will be a good idea to have regular checks of your prostate. I don't know what your opinion is on that as well. Thank you.
So yes, dear, thank you for the question. It is a good question. So after 50, man should visit his urologist once in a year. If he hasn't got maybe family members with the prostate cancer or other cancers. So, and one time in a year, he should check the blood test for PCA to see the level of it, to monitor the prostate cancer. And if we are talking about age of 65 or 64, so it is always, if there is no maybe some history of surgery on prostate or some others, so you ought to visit a urologist once in a year. And there is another critical information that the waiting problems doesn't depend on the size of the prostate. Sometimes man has a small prostate, but the quality of life and the urination is very poor. But sometimes man has a very large prostate, but there is no problem with urination, there is no post-voiding urine, so, and there is no indications for prostate surgery.
Okay, thank you.
Right. Dr. Adam, hello. Dr. Damir?
Yes.
Yes, so there's another question. Someone just sent a question.
Okay.
Says you mentioned that reduction of testosterone level predisposes one to prostate issues. So he's asking if regular sexual intercourse would help prevent this condition.
No, there is no medical evidence that regular sex can prevent the enlargement, but regular sex can prevent the few types of prostatitis. Because as I have mentioned, the first function of the prostate is to give the most volume of the semen. So if it is not working, so there will be a prostatitis.
All right, thank you. Are there any other questions from the public?
Yes. Hello.
Hello.
Thank you, Dr. Damir. Maybe you could slightly talk about the PSA levels.
Okay, what normal level of PSA is? Yes. Okay. Thank you for the question. I don't mention the normal level of the PSA in my presentation because there is we have a maybe rather different information on the different ages due to the medical evidence. But for most population, the PSA level is 4. Underneath the 4, it is normal level of PSA.
All right, thank you.
But if there will be maybe a 70 years old man or a man who has family prostate cancer history, the level of it can vary. And another maybe interesting information in Canada. They have another information, and they have another routine for prostate cancer monitor. They don't check the blood test for PSA. They only produce a digital rectal examination, transrectal ultrasound, and on this information, they give a decision if this person needs a biopsy or operation and so on.
Yandepo, is your question answered?
Yes, it is. Thank you.
Dr. Damir, there's another question from one of our members. So he's asking if exercise helps. If exercise helps in reducing prostate issues.
Not all exercises, but we have medical evidence. It is a proof medical evidence that strength exercises maybe they increase the level of testosterone. Not cardio, but strength exercises. So the strength exercises can prevent decreasing of the testosterone level during the ages.
All right, thank you. Any other questions? Yes. All right, if there are no questions, I would like to thank you so
Yes,
much.
Doc.
Okay.
Doc, hello.
Yes.
Hello.
Yes, Doc. You mentioned that we don't have anything concerning diets that can help prevent or reduce. I wanted to know. We are hearing of this beetroot. Beetroot, is it a fruit or a vegetable that really helps in reducing prostate? I don't know how true that is. Yeah, if you can shed a little bit of light on it, maybe if with some vegetables, fruits, something that can reduce this enlargement. Thank you.
Thank you for the question. Maybe we have some medicine which decrease the level of the protein called 5-alpha reductase, and after this protein is blocked, the volume of prostate can decrease. But we talked about evidence medicine, so we talked about scientific maybe analysis, meta-analysis, and so on. And there is no medical evidence that these roots can decrease clinically the volume of the prostate. It can decrease maybe in 10%, but it is not enough to prevent the voiding dysfunction.
All right, thank you so much, Dr. Damir. I don't know if there are any more questions. Those joining us on YouTube and Facebook. So I think the takeaway message here is for men above the age of 50, you have to see a urologist at least once every year. And I think that's a problem that we have in this part of the world. Usually the only time we visit the doctor is when we are in some sort of pain.
But it's not only in your country, it is in this country too. So we have the same problems. Yes.
I guess so. Yeah. So it's. I think this was a very good presentation to create awareness and at least prompt those who are above the age of 50 to at least go for a checkup. Usually, it's only when we are, either applying for a job or maybe going to school. That's when we do some sort of medical exams. But just like a car needs servicing, right? So
yes.
Same thing with our bodies. We need to. You don't have to wait until it's too late, because if it's too late, it may be fatal. So I'd like to encourage each of us to at least make it a point to educate others, especially those above the age of 50. And if anyone has any of those signs and symptoms that Dr. Damir talked about, please make sure you get some help. All right. Thank you so much, Dr. Damir.
Thank you.
We appreciate it. And if you can stay on, that'll be awesome. I think you have some duties. So.
Okay. It was a pleasure. Thank you.
All right. Okay. So I think we'll move on to the next presentation, which will be by Dr. Isaac Opoguanchi. For those who are just joining us, we are talking about the prostate, and we just had a presentation by Dr. Damir where he talked about benign prostate hyperplasia, which is basically enlargement of the prostate. And now we are going to move on to Dr. Isaac Anchi, who is going to educate us more on prostate cancer. So Dr. Isaac, if you're ready, you can go ahead.
Jeff, Doc wanted to share his screen, so I don't know that if he's ready, we can enable him to share his screen.
Okay, all right, let me. All right, Dr. Isaac, can you hear me?
Yes, I can hear you, but I still don't have the access to share my screen. It said
Okay,
the host participant screen sharing.
all right. Otherwise, you could send
Dr.
us
Anki,
your.
please share. Yes, try it now.
Okay.
Yes, I think I can share it now.
Great.
Yeah. So, Dr. Isaac Kwanchi is a consultant here as well, and I think we met 2 years ago or so in Kumasi. Yeah, so he has a lot of experience in this field and he's very passionate about it. So I'm sure we're going to benefit a lot from his presentation.
Yes, I am pretty sure my screens can be seen.
Yes, we can see your screen.
So let me also take this opportunity to say good afternoon once again to my Ghanaian viewers, and probably good evening or good morning to other people wherever they may find themselves. Let me be very quick to say it is an opportunity to share medical knowledge because it reduces our workload if people are well informed and they make the right decision. We see patients and then we are happy. But then if you see patient and then the outcome is not good, then probably you yourself, you start your funeral before the family members start theirs. Let me also say a very big thank you to the organizers and the moderator for this opportunity. My task is very brief to talk about prostate cancer. I'll start by saying it is quite common. Although we don't have very, very standardized data back home
Sorry,
here.
Doc. Your slide is not showing. Your presentation is not showing.
Okay. Is it still not showing?
No, it's not showing. It's just the.
So please close it and open it again.
Okay. Sorry, is it?
Yes, it's up now. Thank you.
So let me give a little bit of a data, which is very similar to what we are trying to put up here. In the United States, because there is a Black community, we try to co-opt some of their data and try to compare with ours back home here in Ghana. You realize that they have incidents of about 75 cases per every 100,000 men. I mean, when it comes to prostate cancer. And in every year, there is a diagnosis of 190,000 new cases. And the death rate is about 30,000 every year. This presupposes that prostate cancer is quite common and that we need to do regular screening to curb it down.
Doc, we can't see your slides.
Okay, then I have to go back. I'm sure it can be seen now. Hello?
Not yet.
Doc, can you please stop sharing and share again?
Oh, all right.
Well, excuse me, I have to go. Thank you. Okay, goodbye.
All right, thank you, Damir.
Okay. So would be very good if you have some other maybe urological themes, stone disease and so on. Okay.
Absolutely.
Goodbye. Thank you.
All right, thank you. Have a good evening.
I want to be sure if it is now. Okay.
Hello. No, we are still seeing the folder, not the presentation.
Okay.
Share screen.
But then when I try sharing, say host disabled participant screen sharing. Okay, all right.
Hello, Doc. Your slides are visible.
Okay.
Yeah. Can you please go into presentation mode?
Yes. So we can move on now.
Yes, please. Okay, it started.
Yes.
Because my predecessor has talked about BPH, I would want to skip and then we'll move on to prostate cancer right away. Good. Like I was saying, we have incidents about 75 per every 100,000 men. The death rate is about 190,000. That is, 30,000 with the new cases of 190,000. Now, this is very, very important to me. The average age for which we are seeing prostate cancer here back home is around 72 years. But I have to admit, we have seen somebody with 45 years with a very, very, very advanced prostate cancer. And it was quite an aggressive cancer. And so now anytime we are seeing prostate cancer, we want to be a little bit aggressive. Because it's also seen that those of us who are Black, we tend to have a little bit of aggressive cancers. Geographically, it has been seen that people from the Western world, in the US, in the UK, tend to have higher incidence of prostate cancer compared to countries like Japan in Asia. And funnily enough, those of us in Africa, and for that matter, West Africa, tend to have a disease which is quite similar to that in the Western country. Probably it is because we've copied the westernized lifestyle, and more especially with our diet. Now, if I should pause here, the question you may ask is what causes prostate cancer? It is very, very difficult for any individual to say prostate cancer of this very patient is caused by this or that. And because of that, we try to group all of them into what we call the risk factors. And the first on the risk factor list is the high dietary fats. And for that matter, anytime we are consuming so much of fat, then it means we are increasing our risk factor. We also have age. I started by saying the average age we are seeing here is 72 years. However, we have seen people with 45 years. And so, if a child is 10 years, 20 years, 30 years, we don't have much to talk about. But when you hit 40s, 50s, 60s, then your risk also increases. And for that matter, we term age as one of the risk factors. Hereditary is also very, very important. One of the questions that came up with benign prostatic enlargement is that, does it have a hereditary component? It might not be so clear there, but when it comes to prostate cancer, hereditary is very, very, very important. And for that matter, if your father, your uncle, or first degree relative is having a prostate cancer or has been diagnosed of having a prostate cancer, then you, being the male child of that family, also stand a risk. In fact, your risk of developing a prostate cancer if you have a first degree relative is higher than the general population. Let me also be a little bit, let me digress. If you are a woman and then your first degree relative is diagnosed as having a prostate cancer, then you could also come up with breast cancer. In that same vein, if you're a man and then your first degree relative is also diagnosed of having breast cancer, then you could also come up with a prostate cancer. It is all because that particular gene that controls prostate cancer also controls breast cancer. And so it means if you visit your doctor and your doctor wants to take what we call the family history, you should be ready to give out your family medical history really to the doctor. This is going to help the doctor to design a screening protocol for you. Now, the other risk factor we've come to know is cadmium. Cadmium is a substance that is found in cigarettes. And then it's also found in batteries. So the more we smoke, the more we are exposed to cadmium, then it means we are increasing our prostate cancer risk. Now, let's also talk about race. Race is a risk factor in a sense that if you are a Black person or if you belong to the Black race, then you have a higher chance of getting prostate cancer than the Caucasian. I mean, a white man. So what it means is if you're a Black man and a white man is doing a screening at, let's say, 50, 55 years, you being a Black man, we expect you to start a little earlier because the Black race have a higher incidence when it comes to prostate cancer. It is not only prostate, breast is also included. Now, when it comes to symptoms of prostate cancer, there are a whole lot of people who are having a prostate cancer but will not present with any symptoms. It will just happen that, well, I want to start my annual prostate cancer screening. And by which time the PSA will be elevated, your digital rectal examination finding might be abnormal, and then we'll work you up. And then we'll get to know that you have a prostate cancer. So in this class, you say they have asymptomatic condition. Now, the first presenter also talked about some we will term obstructive symptoms and or irritative symptoms, which can occur in benign prostatic enlargement. All these symptoms can also present in prostate cancer. And so it means you could have poor urinary stream. You could also have nocturia. You could also have hesitancy. You could also have urinary urgency. You can have all the lower urinary tract symptoms that can present with prostatitis or benign prostatic enlargement. Apart from this, if the cancer in the prostate also starts invading the surrounding tissue, it could also give the following symptoms. You can present with hematuria, that is blood in the urine. You could also present with dysuria, that is having pain in passing out urine. You could have urinary incontinence. You could also have perineal and suprapubic pain. When I say perineal pain, I mean the pain that is located between your scrotum and your anus. That region is called the perineal region. And so if you have a prostate cancer which has invaded the surrounding tissue, it could also present like this. You could also have a suprapubic pain. That is the region below your umbilicus. That would also could give us a fair idea that you are having this problem. There are some people, all they will present with in the hospital is, my wife is not happy with my sexual function. And at the end of the day, we could diagnose the person as having erectile dysfunction. And once this person is having erectile dysfunction, it could also be something that is leading us to prostate cancer. You know, the prostate is an organ which is located somewhere that our fingers can reach through the anus. And so anytime there's a prostate cancer and the prostate increases in size, the prostate tends to occupy space. And so it gives you the feeling that you want to visit the loo. What somebody will say, it gives you what we call tenismus. Tenismus is the feeling that you want to visit the loo, visit the washroom. And so anytime your prostate is enlarged, which can be due to benign prostatic enlargement or prostate cancer, it could also present with tenismus. There are some few instances where people could also present with bleeding per rectum, what in medical terms we could call it hematochezia, that is bleeding per rectum. In this case, the differential diagnoses are a lot, but for we urologists, we want to be very sure it is not coming from prostate cancer. Because the prostate could also become enlarged and occupy space there, it could also present with constipation, where for a number of days, you've not been able to move your bowel. You could also come with what we call hemospermia. That is when a man and a woman meet and the man ejaculates. People can also have blood in the seminal fluid. Prostate cancer can present like that. However, I don't mean to scare people. It can also occur with people who have also abstained from sex for a number of months, years, or whatever. Prostatitis can also present like that. And so when you see blood in your seminal fluid, don't be scared, because it could also be other things. Even simple stone in the vas deferens can also give hematospermia. Now, when the cancer spread from within the pelvis, where the prostate is located, it then gives you what we call the metastatic symptoms. And with the metastatic symptoms, it could present with lower back pain. And in fact, most people who come with advanced prostate cancer, because the cancer has spread to the spine, they tend to have lower back pain. They could also present with what we call pathological fracture. It means the cancer has weakened the bones. It could be the long bones from our knee to our hip, the bone we call the femur. The slightest force can fracture this bone. In that sense, it is a trivial force that has fractured this bone. And so we term it pathological fracture. There are a number of cases where the first time they are presenting with prostate cancer, they are in a wheelchair. It is because their two limbs have become so weak, they can't stand, they can't walk, they can't even raise the lower limbs as a result of the position of the cancer into the spine. When people present with these symptoms, then we will say it is an advanced cancer. Now, this is what is very, very important to us. We believe with regular medical screening, just as what my predecessor said, can help us to see prostate cancer early. And when we present ourselves for regular medical screening, we want people to give out information readily. There is one thing I've realized with our part of the world. When you ask people, do you have this particular disease in your family? They always try to run away from it, which I think is not very, very prudent. If we ask you, do we have a prostate cancer in your family? For all you may know, the father died of prostate cancer, but he wouldn't want to mention it. the mother has been diagnosed of breast cancer, he wouldn't want to mention it. It is always prudent to know our medical history in terms of family. That is the family medical history. Because I did indicate earlier on that there is a genetic component with prostate cancer. Now, after this history, we expect the clinician to do examination, which should also involve digital rectal examination. In fact, a well-trained fingers in terms of urology should be able to pick some early features of prostate cancer by doing digital rectal examination. With this, the prostate will be hard. The prostate will be very, very, let me say, very hard, stony hard. Let me say that. Even in that case, it could also even be advanced. You could also pick nodular prostate, that is nodules in the prostate. And you could also pick indurations in the prostate. The prostate is, let me say, is a bilobe organ. There is what we call the median sulcus. A trained finger should be able to pick a normal median sulcus. However, if the median sulcus is obliterated, it could also point us to prostate cancer. And so a prostate cancer screening without digital rectal examination is something we don't preach. We expect people to go ahead and do digital rectal examination. One investigation which is very, very important to us is PSA, prostatic specific antigen. Universally, we have come to accept that normal PSA should be between 0 to 4, although there are some allowances from some other literatures. But then anytime the PSA is elevated, we want to find out why, especially if you are a black man. Why? Because the black man has a higher risk. By this, I also want to say that it is not only prostate cancer that will also allow the PSA to be elevated. Prostatitis can elevate PSA. Benign prostatic enlargement can also elevate PSA. So what it means is, anytime our PSA is elevated, we should move extra mile to find out the exact cause of the elevation. PSA combined with diligent digital rectal examination is very, very useful when it comes to prostate cancer screening. And for that matter, we encourage people to go through that. There are several positions we put the patient. We can put the patient on left lateral position. You may not feel comfortable, but it gives the doctor a very good access to the prostate, where the doctor will ask you to lie on your left hand side, that is the left lateral side. You fold your knees so that your knees will be getting closer to your chest. And the doctor will be able to get a good access into the prostate. The doctor could also ask you to assume what we call the jackknife position, where you lean over the bed and the doctor can just go behind you into the rectum with a gloved finger, which is well lubricated. We'll be able to palpate or examine the prostate and give you a fair idea. You could also assume what we call the lithotomy position, where you lie on your back and fold your knees like a woman who is in labor. It also gives the doctor a good access to the prostate. And so your doctor may decide to choose any of these positions. And if your doctor is able to penetrate well to assess the prostate, he will be able to pick, let's say, indurations, arbitration of the median sulcus, or the consistency of the prostate. You'll be able to put all these together and say, no, now let's move on for prostate biopsy. And so there are two absolute indications for prostate biopsy. The first absolute indication is abnormal digital rectal examination findings. The second one is abnormal PSA levels. But there are some instances where we employ what we call the PSA dynamics. The first PSA dynamic I want us to talk about is what we call the PSA velocity. There are instances somebody will come with a PSA which is within the normal range. A PSA of, let's say, 3.5. It is still within the normal range, but still your doctor might want to do a prostate biopsy. Why? It is because, let's assume last year your PSA was 0.2, and within 1 year, your PSA has increased into, let's say, 3.5. You don't have prostatitis, but then your PSA has just increased that fast. Then it means your PSA velocity is very high. And that is a relative indication for prostate biopsy. We also have what we call PSA density. PSA density is where we try to find out the PSA per unit volume of the prostate. And so if your PSA density is also high, although your PSA may be very, very low, we may still go ahead and biopsy you. Or your PSA may be very, very high, but because your PSA density is low, we can suspend the prostate biopsy. These things are very, very, very important to us because you need all these things to make a clinical decision. After that, we can check your urine RE, kidney function test, especially the prostate if it is enlarged and it is blocking the urine flow. Then it means you can present with what we call hydronephrosis. In that case, your kidney function test is also very, very useful. We've already talked about PSA, and I think PSA is very, very useful. I encourage men to do their PSA on a yearly basis. However, if you have a very strong family history, or if you have all the risk factors, sometimes I go beyond the protocols and ask them to do it half yearly. It is all because prostate cancers, like all other cancers, if they are seen early, we can achieve cure. I've talked about prostate biopsies. I do my prostate biopsies under ultrasound guidance, where with the help of the ultrasound, I enter the rectum. I'll be able to pick up suspicious areas of the prostate on the monitor, on the ultrasound screen, and then I take chips from these areas, and then we send them for histopathology. And the pathologists will be able to tell us these are just benign tissue that is not cancerous, or active inflammation, which is prostatitis or chronic inflammation, or there is malignant component that is cancer. Then we'll be able to move on from there. All these things is not just to scare us, but it's just to help us know that your stage at diagnosis is very, very, very important in determining the outcome of whatever treatment that will be chosen for you. There are a number of treatment modalities. It depends on whether the cancer is within the prostate or the cancer has spread beyond the prostate. It also depends on your life expectancy. And it also depends on your comorbidities. That is other factors like whether you have a disease that will not permit us to do anything aggressive. You could go through surgery That is what we call radical prostatectomy. It could be perineal radical prostatectomy, or it could be retropubic. In some advanced countries, you could also benefit from what we call robotic radical prostatectomies. You could also benefit from radiation therapy. And with radiation, we have two types of radiations. We have the external beam radiation, and then we have what we call the brachytherapy, where we insert radioactive substances into the prostate. It means these treatments does not involve surgery, but we are only using radiation. When we see you at the stage where the cancer has spread, that is what we mean by metastatic cancer. These people also tend to do what we call hormonal therapy. And with the hormonal therapy, the principles is taking away the androgen in the body. The androgen is what feeds the cancer. And so we can sometimes, if you can't afford the drugs, we even go ahead to take people's testes, because the testes produces about 95% of the androgens, that is the testosterone. And so once the testes are taken, the cancer, in layman's term, is being starved. And for that matter, these people can enjoy some number of years before the cancer go through what we call the escape route. But if these people can afford, there are a number of drugs in our market that can be given to you either monthly or every 3 months, and it could also suppress these androgens. It all depends on a lot of factors. Let me run off by saying, your fate, when you are diagnosed of having prostate cancer, depends on a number of factors. The first one is the stage at which the cancer was diagnosed. And then as to whether you can afford the treatment or not. Because let me be very honest with all Ghanaian men. National health insurance does not pay for prostate cancer. And so by this, I'm also sensitizing Ghanaian men that we should all one day come up and let the authorities be aware that most people are dying from prostate cancer because they cannot afford the treatment. Thank you. Thank you for giving me your ears. Thank you.
Thank you so much, Dr. Antwi, for that excellent presentation. I've actually personally learned so much, and I'm sure the rest of the you've been very elaborate, and you've explained everything in detail. I'm sure there are a number of questions. So I'll go ahead and open the floor. Please, if anyone has a question, it doesn't have to be on prostate cancer only, but anything on the prostate, you can go ahead and ask.
Hello. Good afternoon. Oh, Daniel, you go ahead first.
Oh, okay, Doc. Thank you. Good afternoon. Yeah, I think it's afternoon, right? Yeah, good afternoon, and I'm happy I was able to join in. Dr. Yafe sent me this link, and I wanted to, just say one or two things. Thank you so much, Doctor, for the presentation. It's very, very helpful. I am a cancer survivor myself, and that's why I wanted to, say one or two things. One, if we have a family history, let us not try to hide it, and let us not be, ignorant, and let us not pretend that it is not there. If you have any traits of any kind of cancer that have happened in your family before, it must be a red flag for you, for which you should be interested in making sure that whenever you have any health concerns, you go to the full length to try and understand what is wrong. The other thing I wanted to comment on has to do with, it is so sad, and I'm saying this because I'm here in California and I still get calls from people from back home who are going through some kind of a cancer situation, and there is this whole confusion with regards to trying to fight things with the traditional means and the medical means, and it is just I just really don't understand it, and it kind of breaks my heart sometimes. I want to plead with all of us. God has given us wisdom. The best we can do is for those of us who are not sick, let us live all the healthy lifestyle we want to live. It is important that we do that. The moment you are diagnosed, please listen to the doctors. Please, it is important. Don't discount. I am not saying that those who are doing the traditional way are not helpful and all that. But most of the time, I see people get things worse before they get back to the medical folks to try and make a way around it. And before you realize, it is just too late. And this kind of conversation can be very, very, very rough, because personally, it did happen to me. I come from a large family. I mean, I have 4 brothers and 4 sisters. It's a family of 10. When my case came up and we were deciding which way to fight it, my family was split. Some felt strongly that, let's do the healthy lifestyle. Let's eat well. Let's do all that and pray. I'm not saying we shouldn't pray. And the other half, who are all into the nursing and the sciences, were strongly, no, if you go that way, you're going to mess yourself up. And it is very, very, very uncomfortable when you are in that kind of a situation and you yourself, you are sick and you are trying to decide which way to go. But I want to beg all of us, God has given us all the medical doctors for a reason. For all the people that are promoting the healthy lifestyle, God bless you. But please do so more before the people get sick.
Yep.
If you are sick, please go to the doctors and go through the process and try and get some help. Because the earlier you seek help might be what might, extend, your life on this earth. I just wanted to, just push this one out there. Thank you so much.
Yeah, thank you so much, Mr. Opunimensa, for that submission. Actually, it's a big challenge here in Ghana. Most people prefer to start with the traditional medicines, and then if that one fails, that's when they come and see the doctors. But unfortunately, for most, it's too late. Especially, I think breast cancer patients. Once they hear of the doctors wanting to cut off the breast or any part of their bodies, then they just go for the traditional medicines, and it's a very, very big challenge. And you brought this up. Thank you so much, Dr. Isaac. And would you like to comment on?
Yes, I've seen a lot of cases here in Ghana where the question is if you should have allowed yourself to be treated last year, last 2 years, last 3 years, you should be doing well by now. But now, I'm sorry, there's very little we can do for you. These have been some of the words we keep on telling them. It is all because people still believe in quotes, our natural way of healing things. If diseases is striking us, is still effective. And I'm sure I'm talking to a lot of Seventh-day Adventists here. In the Adventist fold, one of my greatest challenge is alternative medicine practice. I don't speak against them, but they should know their limits. And when they should ask the people to go and see specialists, when to refer. In the Seventh-day Adventist Church, there's a whole lot of practice of alternative medicine. I don't speak against them, but they should know their limits. Because I've seen a lot of cases with the issue of cancers, colorectal cancers, breast cancers, and the like. I have complained bitterly, and I think the church has a long way to go, not just the community. There was a time a colleague surgeon confronted me. Now you see S.D.A for some whatever. That is why this woman is coming in so late. Come and look at this woman's breast. It was fungating, ulcerating. You ask this woman, why are you now coming? So now you sue S.D.A for this. And so sometimes you can appreciate my frustrations. And I think what the last speaker just said, educate people before they get sick. But when they get sick, please advise them to consult the right people. Thank you.
Okay. Thank you so much. I just have one question for Dr. Andrew. I think you all agree with me that early detection is the key. When it's detected early, the outcome of the treatment than when they present late. Is there a way, or is it possible to start a screening program so that we can detect it early? The reason I'm asking is, in our culture, people go to hospital when they are sick. Actually, in my practice of so many decades, I can count on my fingers of people who have come to say, doctor, I'm coming to check if my eyes are okay.
That's interesting.
So can you help us here? Are there any screening programs going on? Thank you, Dr. Angie.
Yes. There are a lot of discussions as to whether we should make prostate cancer screening, let's say, compulsory, or let's say we should advocate for that so much. Because there is also the fear of what we call overdiagnosis of prostate cancer. But in all these sense, I always tell people, see yourself as an individual, and you yourself seek for screening. I'm saying this because American urological associations and European urological associations, all these have their school of thoughts. As a country, we don't have a stand. And so what we encourage people is, it is good you do screening. We have started screening for churches who come to our doorsteps. We organize prostate cancer screening for the men and some other medical conditions, cervical cancer, breast cancer, and all those things. And sometimes it is after our screening we see that people in their 40s, early 50s are having aggressive cancers. And God being so good, most of them have also gone through treatment successfully. And so it is not a national policy though, but wherever you are, you can at least raise your voice, educate people, and when people come together, there should always be an avenue for us to screen them. And like you are saying, early detection will save lives. Thank you.
Hello, Doc.
So much, sir.
Yes, sir.
Thanks so much for your presentation. And nowadays, people are saying that to use the herbal way of treating prostate cancer is faster than ever. So I'm asking, is it good instead of going to the hospital to be screened and then going to the herbal side and it will give you much problems? I want to know.
I want to say this with some sort of passion because I see a lot of people who will come and then their condition is worse. I see them every day. I am not allowed to mention names of where they are coming from. But what I want to tell you is medical science has traveled through a lot of distances. Medical science has moved through naturopathy. It has moved through all sorts of tricks before assuming this orthodox state. And so I think it's better you see the right people. Because every day I see a lot of people. Sometimes I make fun. I see a lot of people, some professors, some other people. And there was a time I asked a professor who has come late because somebody practicing alternative medicine somewhere has delayed him. He said, oh, don't worry, I keep on scanning your prostate. Your prostate volume is becoming smaller.
to generally help us have a good prostate? Because I've heard that tomato is a good vegetable that can help us. So that's my question.
Yes. Do I have the please?
Yes, Dr. Anchi, you can go ahead and answer that question.
Yes. There's been a lot of speculations when it comes to prostate health, and then a number of plant products that are useful. There's been a lot of researches that has been carried out concerning prostate diseases. But in all these things, it has never come out so conclusive that when you take this vegetable or that, but still it is being recommended.
Hello, Doc. I think you've gone off. Hello, Dr. Entry.
I think he went off.
Yeah, he's no. Yeah.
Dr. Anchi, can you hear us?
Yeah, hello, can you hear me?
Yes, we can hear you now.
Yeah. There's a number of speculations that some phytochemicals can help us fight against our prostate disease. One of the commonest phytochemicals that has been well studied extensively is lycopene. Lycopene is found in tomatoes. And so there is always a notion that if you take good amount of tomatoes, you are protecting your prostate. Yes, it's possible, but it has not come out so clear. Tomatoes, watermelon, because most of the literature says melon seeds. But then, like I said, we live in a scientific world. So we will still say they are speculations, but maybe they could be useful. On this note, I would also be quick to add that vegetables, plant products, that is fruits, seeds, and nuts, have been seen to be useful when it comes to prostate cancer more than animal products. And so when you push me to the wall, I would advise you to spend more time on plant-based diets rather than animal products. And you realize that most of the drugs that we prescribe aside the orthodox medicine, they have this lycopene, which is commonly found in tomatoes. They have lycopene in them, they have selenium, and then they have other minerals. But these are the two cardinal ingredients that they tend to promote.
All right, thank you, Dr. Anchi. Doc, I think there's one more question.
Yeah. So, Doc, my other question is, so what other preventive measures can you take? What, apart from diet, are there any other things that you can do to prevent the occurrence of this?
Dr. Anchi?
Yeah, hello.
Yes, please, there was a question.
Yeah, the
He was
question is,
asking.
apart from diet.
Yes.
Yes, apart from diet, you know, I did mention that exposure to cadmium, which is a substance found in cigarettes, and then also batteries. And so it means exposure to cadmium can also be minimized. But having said this, you know, I said all these things are classified as risk factors. It is possible you may not have any of these exposures, and yet you could still come down with prostate cancer. And so, my best advice is, I don't know your age, but from late 40s, if you are a black man, start your prostate cancer screening. Because I have seen people who are strict vegetarians with prostate cancer. Anyway, those are solved. Their cancer was not the aggressive type anyway, but we still went ahead and give them a comprehensive treatment. And so it means, yes, being a vegetarian is important. Eating fruit and vegetables are important, but we have still seen some with prostate cancer. Again, I have seen people in quotes who are, let me use the word, Roman fathers. They don't have any sex life in quotes, who are also come down with prostate cancers. I have seen people who have several wives who have also come with prostate cancers. And so now it is very difficult to say, assume this very lifestyle and you will stay away from prostate cancer. It is good to live a healthy life, but the most important thing is regular medical screening, so that if anything should crop up, we can see them early and aim at a cure rather than palliation, where we are only trying to control the disease in a way which will eventually also take you away. Let us see the disease early so we can aim at cure. Thank you.
All right, thank you, Doc. There's another question that is being asked. Someone is trying to find out, says, normally these days, getting to see a specialist is not easy. Say you want to be screened, right, for prostate cancer. What's the process? Do you go to any hospital and ask to be screened, or do you request to see the specialist, or any general practitioner can do that?
All right, thank you. I must admit that we don't have more urologists in Ghana. In fact, I know all the urologists in Ghana, so you can imagine. But thanks be to God, there is at least one urologist in every region in this country, at least. And so if you really want to see somebody, you can see somebody. As for PSA, most general practitioners should be able to take you through. But then when it comes to the PSA dynamics, and then probably somebody doing digital rectal examination, I recommend a specialist. And you can do that by getting to your general practitioner and asking you want to see the urologist. He will easily direct you, and it shouldn't be difficult. Sometimes they will do all the initial things, preparations, check your PSA, take the family history and all those things, and they will forward you on to the urologist. It shouldn't be difficult. Those of you in Accra, there are a lot of them there, and you should be able to get the right screening.
right, thank you, Doc. I don't know if we have any more questions. If you have any other question, please, this is your chance.
All right. My name is Ebenezer. I'm actually calling in from Canada. And thank you, Dr. Boatimweafe, for sending me the invitation. And all the information I have listened and watched actually have given me a lot of good information and education. Actually, it's a wake-up call for me. And thank you guys so much. My question is, Dr. Isaac, can you please give me a bit information more about the prostatic specific antigen?
Good.
Thank you.
Yes. Mr. Chairman, do I have the floor?
Yes, please, Doc.
Good. Prostatic specific antigen is a human protein. And let me say, it is one of the tests that we do in the hormonal array. It is also known as a tumor marker. When I say tumor marker in the practice of medicine, it means tumor marker is a substance that is produced in the body that can be used to diagnose and monitor diseases. And so PSA is one of the tumor markers in the body. The other tumor markers I can think of in urology is ACG, beta ACG, which is also used to manage testicular tumors. We also have LDH. There are several tumor markers. However, prostatic specific antigen has become very useful in our practice because it is organ specific. When I say organ specific, it means it is only specific to the prostate. And so prostatic specific antigen is used and it directs us straight away to the prostate. However, prostatic specific antigen is not a disease specific. When I say it is not a disease specific, what it means is there are a number of diseases that can come up when your PSA is elevated. The first one is prostate cancer, where your PSA can be very much elevated. Sometimes you can see a PSA as high as 10,000, as high as 20,000, as high as 9,000 something. And right away, you know, no, this one, I am dealing with a cancer which probably might have spread from the prostate. Sometimes you could also have PSA, which is also above the normal one, 4, or some allowances added to it, 5 or whatever, which can also be due to benign prostatic enlargement. In this case, what is so important is the PSA dynamic. You want to find out the PSA per unit volume of the prostate. You need that one also to make a decision. Now, the third diseases that the PSA can also direct us to is the prostatitis. The white man did a presentation and then he was like, if you are 40 years and below, probably it could be prostatitis. Yes, I am seeing a lot of prostatitis cases here in Ghana. In fact, every week I diagnose a lot of prostatitis. And in that case too, your PSA could also be elevated. We have total PSA and then we have other dynamics of PSA. But then all I can tell you is it's organ specific, but not disease specific. If this information is inadequate, probably I can add more.
Eben, are you satisfied with?
Yes, I am. Thank you.
All right, thank you. That was a great question. Thank you, Dr. Anchi. I think our time is almost up. But if there's one more burning question, I think we can take it. Otherwise, we would like to thank you so much, Doc, for this rich presentation. I'm sure we have all learned something, most especially early detection and prevention is key. And if you experience any symptoms at any point in time, please don't waste time, but seek expert medical advice. And our consultants are around. So if anyone needs any private consultation or anything, you can always contact us, and we will direct you to the necessary, to the right specialists. Thank you so much, Doc, for your time and for making yourself available. We appreciate it so much. And I think going forward, we should have more of these. I think it would go a long way in helping our patients and creating awareness. Thank you so much, everyone, for joining this call. Yeah, we had members from actually all over the world, Zambia, Canada, from the US as well. So thank you everyone for hopping on to this call. I will hand over to Joseph.
Okay, yes, Jeff, thank you so much. And we want to express our appreciation to all those who were able to join us, especially our facilitators. Dr. Isaac Entry, we are so much grateful for your time. I know you're a busy man, but you've made time to join us this afternoon. God richly bless you. We also thank Dr. Damir, who left midway during the program, who joined us all the way from Russia. We also thank him so much for joining us. And our own Dr. Jeff, we're also grateful for moderating this event or this program for us. We also thank all those who joined us on Facebook, YouTube, and those who are here on Zoom. We are grateful that you joined us. But let me say that this is not the end of our programming. We will have these or series of these programs every month. And we have 2 programs lined up in the month of May. It wouldn't be only on health. We have series of programs that we are going to run. Actually, the next program is on retirement planning, which is in the month of May. So we will kindly ask that you join us whenever you receive the invitation. Let me also say that this is Bethel S.D.A. Church, the or Adventist Men's Ministries. And I want to invite those of you who can join us on the 1st of May. We are having the foundation stone laying and fundraising ceremony of our church building. Those of you who probably haven't been here for, say, about 2 years, if you come here now, you see the magnificent structure that, by God's grace, we've been able to put up. So on the 1st of May, we want to invite you to join us to lay the foundation stone for our building. We will take our closing prayer from our mother. We are grateful that we had some women joining us. So we'll take the closing prayer from Auntie Pat.
Okay. Hey. Shall we pray? Nuncho wanda bushi. Inekeni kasemo wulu nuke hawone. Wanda bushi. Akeshi ubi ahiabu. Nisa akeshi onile nuke ha adisan ejiku. Nuncho wankpabo fa akeshi wobehi waleku. Nuobanye nuku wofi. Akeshi oha mofemo. ni le ni ba ko hila sro to ni yowo no ka ya hila chamo hi na kwele mla hawo nto wonda bo si hu ye meni ka me fosi ye ni ka se mo mi no ke ha meni amehu ameke ba hawo ne nto jo mo ame no ha meni le mi ati ona fini fe na ba ya na bo Kristo ye jeme meni hu ni sumo ni ame ya hila chamo hi kegbe yi se mo nto won pa bo fai no mo mo konkro den cha kanya me na me ya na makwe na me die aye ke chufa chumo ke meni gbe ame ke ni bi fe ke jeje ona fe no owo hi enyam ye ni bi fe mi won pa bo fa wo ba shi no wo ya hi wole wo no kwemo won tu wo ife won wo den ke wo weku ke wo sun lo efe ninu ncho ko ono o chi he mi no ba bote ne no jowo yo bi Yesu Kristo gba mi amen.
All right, thank you all and see you soon.